If you're experiencing joint pain and wondering if it might be rheumatoid arthritis, or if you're looking for ways to manage it, you've come to the right place. In this video, we're going to talk about what rheumatoid arthritis is, how it's diagnosed, the medical treatments available, and even some natural remedies that have science behind them. So stick around because we're going to cover everything you need to know. Understanding rheumatoid arthritis. Rheumatoid arthritis isn't just about joint pain. It's an autoimmune disease where your immune system attacks your synovium, the tissue lining your joints, causing inflammation. Over time, this can lead to erosion of cartilage and bone and joint deformities. But what many people don't know is that RA is a systemic condition. It can affect more than just your joints. Organs like your lungs, heart, and even your eyes can be impacted. A unique aspect of RA is something called extra-articular manifestations. This means RA can cause issues like lung inflammation, interstitial lung disease, cardiovascular complications, or even Felty syndrome, where the spleen enlarges and your white blood cell count drops. This is why diagnosing RA early and managing it aggressively is so important. It's not just about protecting your joints, but your overall health. Advanced diagnostic. When it comes to diagnosing RA, doctors rely on more than just symptoms and a basic blood test. There are some very specific tests and imaging techniques that can catch RA in its early stages, which is crucial for long-term management. 1. Anti-CCP antibodies. This is a game changer in RA diagnosis. If you test positive for anti-cyclic citrullinated peptide, anti-CCP, antibodies, there's a 95% chance you have or will develop RA. It's one of the most specific tests for this condition, even more so than the traditional rheumatoid factor, RF test. 2. Ultrasound and MRI. For years, X-rays were the go-to for looking at joint damage, but now ultrasounds and MRIs are leading the way in detecting inflammation and early joint damage. Ultrasound can spot even subtle joint swelling that might not be visible through X-rays, making it a vital tool for early detection. 3. Erythrocyte sedimentation rate, ESR, and C-reactive protein, CRP. These blood tests measure inflammation in your body. What's interesting is that even when symptoms are mild, high CRP or ESR levels can indicate an active disease process. It's like your body's alarm system going off before you even feel it. Latest medical treatments. Let's talk treatments. This is where things get really exciting because the medical landscape for RA has changed significantly over the past few years. It's no longer about just controlling symptoms. Now, it's about halting disease progression. Number 1. Biologics. You've probably heard of biologics like Enbrel, etanercept, or Humira, adalimumab, which target specific molecules involved in the inflammatory process. What's fascinating about biologics is that they're not one-size-fits-all. There are TNF inhibitors, IL-6 inhibitors, like tocilizumab, and B-cell inhibitors like rituximab. Your rheumatologist will tailor the choice based on your unique disease profile. 2. JAK inhibitors. This is the new frontier in RA treatment. Medications like tofacitinib, Xeljanz, or upadacitinib, Rinvoq, work by blocking the Janus kinase pathways, key players in the immune system's overreaction. The advantage here is that JAK inhibitors are oral pills, unlike biologics that are often injected. 3. Methotrexate. Optimization. Methotrexate has been the backbone of RA treatment for years, but did you know that adding folic acid can reduce its side effects? Or that using subcutaneous injections instead of oral tablets can make it more effective and easier to tolerate for some patients? 4. Tapering biologics. There's also growing evidence that once patients achieve remission, they may be able to taper down on biologics under close supervision, meaning fewer injections and less cost. But this should only be done under a doctor's guidance. Natural remedies. While medications play a huge role, more and more studies are showing that certain natural remedies can complement traditional treatments and help with symptom management. But the key here is evidence-backed remedies, not just folklore. Number 1. Omega-3 fatty acids, fish oil. Omega-3 fatty acids, especially from fish oil, have been shown to significantly reduce inflammation in people with rheumatoid arthritis. Multiple studies confirm that omega-3's lower levels of inflammatory molecules like cytokines. In fact, research has found that patients taking high doses of fish oil experience less morning stiffness and joint pain. 2. Turmeric and curcumin. Curcumin, the active compound in turmeric, is a potent anti-inflammatory. Scientific studies have shown that curcumin can reduce RA symptoms such as joint pain and swelling, with some research indicating it may work as effectively as certain non-steroidal anti-inflammatory drugs, NSAIDs. Curcumin blocks inflammatory pathways, including NF-κB, which plays a major role in RA. 3. Boswellia serrata, Indian frankincense. Boswellia serrata, commonly known as Indian frankincense, has been used for centuries to treat inflammatory conditions. Research shows that its active compounds, called boswellic acids, reduce joint pain and inflammation in people with RA. Clinical trials have found significant improvement in physical function and a reduction in joint stiffness for those taking Boswellia supplements. 4. Probiotics and gut health. Emerging research shows that maintaining a healthy gut microbiome could be important in managing autoimmune diseases like rheumatoid arthritis. Studies suggest that certain probiotic strains, such as Lactobacillus casei, can reduce inflammation and lower disease activity in RA patients by modulating the immune system. 5. Heat and cold therapy. Applying heat and cold to affected joints can provide immediate relief. Heat therapy helps relax muscles and improve blood circulation, reducing stiffness, while cold therapy numbs sharp pain and reduces inflammation. Studies show these therapies can be particularly helpful during flare-ups. 6. Meditation and stress management. Chronic stress is known to worsen RA symptoms. Scientific studies on mindfulness-based stress reduction, MBSR, have shown that regular meditation can reduce inflammatory markers and improve overall well-being in RA patients. Practices like mindfulness and deep breathing can help lower stress-induced flare-ups by calming the immune system. Host: rheumatoid arthritis can be complex and challenging, but with the right diagnosis, treatments, and lifestyle changes, it's possible to lead a healthy, active life. If you found this deep dive helpful, don't forget to like, subscribe, and hit that notification bell to stay updated on future videos. And in the comments, let me know, what's been the most effective treatment or remedy for your RA? I'd love to hear your story and start a conversation.